If you are suffering from severe pain during menstrual cycle or just before start of menstrual cycle, then in this video I'm going to share with you some of the practical tips that you can apply in your life, and maybe these tips will be the total answer, the total cure of the pain that you go through. I can understand. I see this very often in my practice. I know how hard it is and how painful it is to go through this menstrual pain. So I'll try my best to help you out through this video. Hi, my name is Dr. Vivek Joshi and welcome to my YouTube channel. First, we have to understand different problems that a female can have in the uterus that can give pain or heavy bleeding. So if you are suffering from heavy bleeding and periods, they reoccur after 15-20 days, or there is again bleeding after 15-20 days, it can be because of fibroids in the uterus, or it can be because of the polyp. Mainly it happens because of the fibroids formation in the uterus. Second, if there is not too much blood flow during the period, or if blood flow is normal but the periods are not on time, they are delayed. For example, some month they occur after 35 days, next month maybe 40 days, then 50 days, and then again 28 days. If this is happening, then it can be because of polycystic ovarian syndrome or PCOS or PCOD. And in this case, there can be overgrowth of hair in unwanted parts. These are some of the symptoms of PCOD or PCOS. Actually, in endometriosis, the tissues similar to the lining of the uterus, that's endometrium, grows outside of the uterus. And this causes severe pain. So maximum of the females, I can say 99% of the females who go through severe pain during menstrual cycle or just before the start of menstrual cycle, they all might be suffering from endometriosis. Practically, I have seen it a lot. Maximum of the females who go through such huge pain, they all are suffering from endometriosis. So what is the treatment of endometriosis? I'll tell you, according to the Ayurveda, the holistic medical science, Ayurveda says use of Kaishor Gugul. You can find it in the tablet form. Many companies make it by whichever you like, and start using 2 tablets 2 times in a day, empty stomach. You have to drink warm water, and throughout the day you have to drink warm water if you will be taking Kanchanar Gugul empty stomach. Second is the herb name Ashoka. Ashoka is very powerful herb. Botanical name is Serica ashoka. Ashoka actually reduces the inflammation happening and it gives strength to the uterus. Also, it regulates the hormones. Third is Lodra. Lodra, it reduces the bleeding. It reduces the extra formation of these cells that are forming out of the uterus. If you want to cut down their overgrowth, for this, Lodra can be a good option. Third is Shatavari. If you are not suffering from fibroids or any kind of cysts, then you can use Shatavari for 2 to 3 menstrual cycles. You can use it in the tablet form, 1 or 2 tablets 2 times in a day, empty stomach. You can use them. If it will be hard for you to find Ashoka and Lodra in tablet form or in the powder form, if you'll take them in the powder form, you can mix both of them. You can mix both of them in equal quantity. For example, 100 grams of Ashoka, 100 grams of Lodra, mix them and store this mixture in an airtight container, and you can take 1 teaspoon 2 times in a day, empty stomach. You can mix it in water, or you can just drink it with warm water as you are comfortable. This is how it's taken. But if you are not comfortable to take in this way, or it's not easily available, then you can go with an Ayurvedic tonic. Name is Ashoka Arisht. Many companies make it. So Ashoka Arisht has to be taken 15 to 20 milliliters with equal amount of water 2 times in a day after food. So these are my general recommendations about the herbs. If we talk about the diet, then you have to eat warm and nourishing food like fruits or cooked vegetables. The thing that is easy to digest, those things you have to consume. 3 spices, those are very important if you are suffering from endometriosis. First is ginger, second is turmeric, and third is cinnamon. Consume them every single day. This is going to help you a lot. Now, the most important and most effective treatment, it is Basti. In general language, we can call it enema. If you will start using enema just 2 or 3 days before your period starts, you will see a drastic change. You will see that you are not suffering from the pain and discomfort just by simply using oil enema. Which oil to use? The best one will be Sahacharadi oil, written over here. I know it's hard to remember and to pronounce. Use 60-70 milliliters of this oil, and you have to add 1/4 or a little bit less than 1/4 teaspoon of Himalayan pink salt to this oil. How to add? First, you will take the salt, you will crush it well, you will mix it, and this is your enema. You have to take it just one time in a day, that also just after your meal. You can take it just after your lunch, or just after your breakfast, or just after your dinner, as you are comfortable. And this enema is not going to just come out. Your body is going to retain it. As long your body is going to retain it, that much better it's going to be for your body. If this oil is not available, totally not available, then you can try with sesame seed oil. Maybe just enema is going to do magic. But you have to work on your uterus also. And in this, the herbs that I have said, those will be working. Your digestion should be good. If your digestion is not good, then you can use Triphala, just 1 teaspoon at night before sleep. You are going to get much benefit if you are going to use Ayurvedic herbs. Also remember not to indulge in severe physical activities during menstrual cycle. I want you to pass this information to every single female that you know, that don't indulge in vigorous physical activities. Do your normal daily work. So don't do this mistake. I have seen that this is one of the biggest reason of getting endometriosis. I don't want you to suffer, or any female to suffer with this. That's why I'm trying to help you through this channel. All the recommendations that I have given over here, these are general recommendations, but with my experience, I think that many of you are going to get good results, especially with enema. Thank you for watching this video up to this part. I have tried my best to help you out, and I hope this video will be helpful for you. See you in next video with a big smile. Up to the time, smile more, stay happy, stay healthy.